Dr. McPherson, thank you so much for your time.
Thank you. It's a pleasure to be here.
Would you mind telling us, to begin, about how you ended up at UT and a little bit about your career here?
Okay. So for many of you who are not going to be from Texas, I was brought down by one of our previous presidents who just recently passed away, Dr. James Willerson, who ran internal medicine, then was the president of UT Health Science Center, Houston. He's a very famous cardiologist. He was the editor for Circulation, our premier journal, for at least 15 years. And he knew my old boss in Chicago. And so he asked and brought me down to interview. I had never really been to Texas before. And I had a big lab that I was going to have to transfer, which I transferred. And he said to me, he said, David, we do things in Texas differently. In Texas, it's not about how you negotiate. It's about what you want to do a better job. And can we give you the items that you can actually succeed here? So basically, I came down with 6 clinicians and 6 research faculty with a laboratory. And for those of you who are from the north, I want to tell you this. Okay? We came down in August, and I have never had so many complaints about Texas, about the weather, about how hot it was going to be, blah, blah, blah. So I thought, well, 2 can play this game. So I sent everybody back, my research people, my clinicians, back to Chicago for a meeting in February. So all of you Northerners know what Chicago's like in February. They came back after the meeting and they said, we will never go back there. They've all stayed, and we've been here now almost 12 years. So they've stayed, they've done extremely well. They've flourished. The research lab has flourished. The clinicians have flourished. Our educational programs that they helped to develop have flourished. And this is a place that once you commit to yourself, you can do a fabulous job. So basically, you know, it was the smallest chance we took in the world from Northerners coming down to the South. And it was probably the best thing that that all of us did.
I definitely identify that after moving down here from Boston. I also was a little shocked in the summer, but now, I mean, it's September and it's gorgeous here, right? Well, tell me a little bit more then about the research program that we've built here. I mean, I think this is one of the things that is most phenomenal about our department. I'd love to hear more about the research opportunities that would be available to applicants for our residency program if they choose to come.
So let me start small and then into the big. So in cardiology, we have a number of research programs. We have probably one of the most famous, if not the famous, world-renowned positron emission tomography laboratory that Dr. Gould runs. It's world famous. It helps to identify real blood flow in the heart at rest and with stress, so you can identify the coronary disease for your patients. Their clinical opportunities and research opportunities are unbelievable around here. I think if you come into our programs, you will get a clinical mentor, and most of our programs also get an academic and research mentor for you. So we expect that you would then get some training in researcher quality. Quality initiatives are fabulous research initiatives, and clinical training as well. So I think that your opportunities here are limitless, and it's only the amount of time that you can spend to take advantage of these opportunities. So did that more or less answer your question, Dr. Swales?
That was perfect. It was an amazing exposition on the rich research and clinical environment here. I'm not even sure I have very many more questions. Let's see. I think those are the main things that I wanted to ask you about research. I wanted to ask you about the clinical environment and make sure I think the applicants probably understand the broad reach of the opportunities here. Is there anything else you think our applicants need to know about the faculty or the opportunities that they'll have here?
So I think, and I don't want to brag about this, but you know, we have 16 divisions in internal medicine. Including one that provides statistical services. So if you have a research project, our Division of Clinical and Translational Sciences will provide you statistical help to do your research. We have about 300 faculty, 400 learners, give or take, and 300 admin staff. But most importantly, we have some of the largest training programs in the country. We are in the top 3 for the largest cardiology training programs in the country. And a number of our other ones, critical pulmonary critical care, gastroenterology, our subspecialty training programs, they are ranked among some of the largest in the country. They provide both clinical and research opportunities. I'm just going to tell you, cardiology provides clinical opportunities from adult congenital all the way to advanced heart failure, but we send our fellows down to Corpus Christi for basic outpatient clinical training. We can send our fellows to Beaumont for adult congenital outpatient training and do the traditional LBJ County Hospital and Memorial Hermann private hospital, as well as our clinic training. So we give people lots and lots of broad range training and research in each one of our specialties. So I think you probably need to understand that this is a good segue. A lot of people want to go into specialties, but just please remember that what this country needs are general internists, general specialty docs, and not so many of these way advanced subspecialty docs. You need doctors to see and treat patients. And that's the one thing COVID has brought to the forefront, that it's nice to have some super high specialty doc, but without the general doctors, you can't get the work done. So I think that, you know, coming into internal medicine, you have to realize that it's an honorable profession that is so sorely needed in this country. Those 3 years are actually could be the best 3 years of your life and could get you into a fabulous career.
I totally agree. And I think that the way you describe the opportunities that we have to serve our community and how we see it really as an opportunity, whether that is the pandemic or the underserved population that we work with, I think that that really personifies the ethic that we have in our department. So I appreciate your time, Dr. McPherson. Thank you so much.
Okay, have a wonderful day. Thank you.